Good afternoon and welcome to the Midday News. Here's what we have in the bulletin. No mold. The clinical coordinator dispels rumor of infestation in operating theatre at Cornwall Regional Hospital. St. Anne and St. Thomas report an increase in dengue cases. And later in sports, JFF remains calm ahead of Reggae Girl storm. Thank you for joining us. I'm Shane Masters, and here are the details. Clinical coordinator for the Cornwall Regional Hospital, Dr. Delroy Frey, is dispelling reports of a mold infestation at the main section of the hospital, which is being renovated. In an interview with TVJ News, Dr. Frey said that the infestation was identified in the corridors outside the two operating theatres at the Type A facility. He says an inspection was carried out after complaints were made by those working in the makeshift theatres.
What we discovered was that within the theatre confines itself, we did not discover any mold, and this was concurred with our public health inspector. But the corridors and the ducts coming in with the AC was where we identified mold. So we used the opportunity, because staff were complaining, to close down the area, and we are in a refurbishing mode for that area now, because it's absolutely important that we have that facility working, because that's where we do our emergency surgery.
Dr. Frey says some mechanisms have been worked out to deal with the expected fallout.
There was a small operating theatre that was created in the accident and emergency area. That area we are using for the absolute emergencies that come here. I know someone might wonder, what if 2 or 3 emergency comes in at the same time? Then we have work out an arrangement with our neighbor, the Montego Bay Hospital, where we can do emergency cases.
Health Minister Dr. Christopher Tufton says the Know Your Numbers campaign that was recently launched by the Health Ministry is already showing startling data of sick people in the population. Speaking to TVJ News recently, Dr. Tufton says last week in Falmouth, Trelawney, the health team examined 1,600 people. Of that number, 450 did tests. Dr. Tufton says surprisingly 100 persons had to be referred to the medical doctor for follow-up exams.
Because their numbers were off. What it meant in practical terms, that there are people there who didn't know they were diabetic and found out, didn't know they were hypertensive and found out. And invariably, what happens is that they probably wouldn't know until they get a stroke or a heart attack, and they end up in the accident and emergency ward, which is why this program was created. A 30% pickup of abnormality in a population is alarmingly scary. It means that probably 20-30%.
Dr. Tufton is concerned because the data is showing that a number of Jamaicans are not healthy.
Where do you end up in the hospital? In the hospital. So we have to promote screening, as we are doing now through Know Your Numbers. Our next stop is in Linstead on Saturday. We have to promote more prevention medicine. That's why primary health care is so important. So things around nutrition, exercise, that kind of thing is going to be critical, because you're not going to be able to provide enough hospital beds for everybody. And that data that I read at Falmouth proves to me that this approach is correct.
A St. Mary family has been left distraught after a relative was killed in a hit-and-run accident. It's understood that 64-year-old Garth Gooden was crossing the road in Boscobel minutes after 6 o'clock yesterday evening when he was hit by a vehicle. While efforts were being made to take him to the hospital, he was run over by another vehicle, killing him on the spot. Neither of the drivers stopped. According to relatives, Mr. Gooden was mentally challenged. The St. Mary police are asking anyone with information on the vehicles to contact them or Police Emergency 119. The parishes of St. Anne and St. Thomas are reporting an increase in dengue cases. While vector control activities have been ramped up, there are other factors causing the spike in cases. The details in this report from Kerry Simpson.
A total of 104 dengue cases were reported up to October 8 in St. Anne. 62 of those cases were suspected, 4 presumed and 14 confirmed. Medical Officer of Health for the parish, Dr. Tamika Henry, says in September there were 2 confirmed cases. However, as at October 9, there were 12 confirmed cases. She says vector control activities have been taking place. However, fogging has been slightly hampered by the rain. It is why she is encouraging citizens to do their part in eradicating mosquito breeding sites.
We just want to impress upon everyone the importance of keeping our surroundings clean, not to litter, so that we can prevent mosquito breeding. For those who store water at this time, a lot of persons are storing water. We need to ensure that we're covering those containers. We can't leave them open because the mosquitoes are going to breed on the surface of the water.
Over in St. Thomas, the health department is reporting 18 confirmed dengue cases, with the numbers steadily increasing. Medical Officer for Health for the parish, Dr. Dorian Smith, pointed to another serious challenge.
The majority of our mosquito breeding, 85% of our mosquito breeding, is in drums, 45-gallon, 55-gallon drums. People are storing water because there's a shortage of water in the parish.
Dr. Doyen says while water in drums are treated,
sometimes people get new drums before our next rotations. Sometimes people wash out the treatments out of the drums. So what we have to do is encourage persons not to wash out the treatments that we make to the drums, and also for persons to keep their drums covered. But if we're going to look at solving an issue, you go to the base of the issue. And there must be better water distribution in the parish. There are several rivers in the parish. We have the opportunity for catchment and proper treatment of these river waters and distribution adequately.
He says the health department will continue its surveillance of dengue as the country deals with the outbreak. Carrie Simpson, TVJ News.
The establishment of a guidance and a therapeutic center in St. James is expected to provide support for hundreds of young people with behavioral issues. As Sandy Williams reports, the facility will provide increased access to mental health services for students as well as parents in Western Jamaica.
This is the proposed location for the construction of a child and adolescents guidance and wellness center in St. James. The move comes at a time when schools are grappling with behavioral challenges among students. According to the Minister of National Security, Dr. Horace Chang, the initiative was born following research findings indicating that adolescents with abnormal behaviors suffer from emotional challenges.
The need for this kind of work was clearly demonstrated because this is how we have to intervene and intercept at a point where we can prevent the young individuals, especially young boys, growing up into a life of violence and criminality.
For Director of the Education Ministry's Region 4, Michelle Pinnock, the facility will operate similar to a one-stop shop.
So we're talking about the Ministry of Labour and Social Security being here to probably provide support for parents. We're talking about the Ministry of Health being here to provide whatever support is required. Of course, Ministry of Health as well. So what we're seeing here is an interministerial collaboration in one location where we're able to really support our students.
Dr. Chang adds that the center will allow teachers to refer students to a special facility dedicated to dealing with such behaviors.
When we find a youngster in school who may have problems, this service will, once they've been identified and counseled and have discussion, we will seek to reach out to the entire family. And while our social network is not that narrow and big, it is quite strong, and if we get them interface with them and get them involved in new productive activity, we know we can resolve some of the crucial problems.
The facility, which will be the first of its kind, also caters to parents and provide counseling, skills training and job placement. The project is a joint partnership between the Ministries of National Security, Education and Health, as well as the European Union and Sanders Foundation. No timeline was given for the completion of the center. Sandy Williams, TVJ News.
And it's time for a break here on the Midday News. Stay with us. More stories when we return. Welcome back to the Midday News. Deputy Mayor at the St. Thomas Municipal Corporation, Rowan Bryan, is blasting the National Works Agency NWA for its absence at the corporation's monthly meetings. He says it has been years since a representative from the agency has showed up to a monthly meeting.
And not coming to none of the meetings. And at the same time, we here activists trying to figure out what's happening. Then pave the road, then dig out the road. Then pave the road, it's been dug up again. Then pave the road, then do the same thing all over again. Now we need some answers. Somebody need to tell us exactly what's happening.
The Deputy Mayor said the roads in the parish are damaged due to the constant road repairs. He highlighted the deplorable road condition in front of the St. Margaret Hospital and as a result the build-up of traffic on a daily basis. Mr. Bryan is calling on the National Works Agency to send a representative to the monthly meetings to address the issues.
Stop take St. Thomas people for fools. This has been happening for too long. And if they don't have the proper guideline and the proper contractors to do the work, go abroad, go find the good contractors to do the work.
And the personnel from the National Works Agency, NWA, has for some time stopped attending municipal corporation meetings island-wide. The agency says if members of a corporation require updates on projects, they can use other mechanisms to get the information. And it's time for the Business Minute. A number of clients with brokerage accounts at the Embattled Stocks and Securities Limited, SSL, have confirmed with our news center that they have received the sums held in their accounts. A few of the investors say the funds were transferred to their bank accounts this week. Last month, Finance Minister Dr. Nigel Clark announced that SSL's $1 million insurance payout was made on September 7. In addition to operational expenses at the firm, the funds would cover Jamaican dollar payouts for clients. The clients also confirmed that the transfer of their brokerage accounts to other entities is in train. Further afield, home sales dropped last month in the U.S. to the lowest level in 13 years. Sales of existing homes fell 2% from August to September to a seasonally adjusted annual rate of 3.96 million units. That's according to a monthly report from the National Association of Realtors. This comes as surging prices and mortgage rates have pushed many would-be buyers out of the market. Now, according to data from Freddie Mac out on Thursday, the 30-year fixed-rate mortgage averaged 7.63% in the week ending October 19. That's up from 7.57% the week before. And that's it for the Business Minute. Time now for the top regional and international stories.
In the region, Haitian police have arrested a former Justice Minister official suspected of ordering the assassination of President Jovenel Moïse. Joseph Felix Badio was caught while he was driving out of a supermarket car park in the capital Port-au-Prince. Mr. Moïse was murdered in his bedroom by Colombian mercenaries in 2021. Most have since been arrested or killed. His death threw Haiti into a prolonged political crisis and has led to unprecedented levels of lawlessness. On the international scene, Canada has withdrawn 41 diplomats and their families from India after New Delhi threatened to revoke their diplomatic immunity amid a deepening dispute over the assassination of a Sikh activist. The move follows a series of tit-for-tat diplomatic expulsions between the two countries following the June killing of Canadian citizen and prominent Sikh leader Hardeep Singh Nijjar. India has suspended visa services for Canadian citizens over what it says are security threats against diplomats in Canada. On Friday, Canada announced it was temporarily suspending in-person operations at consulates in several Indian cities. And Israeli citizens can now travel to the U.S. without a visa. Originally, Israel's participation in the visa waiver program was set to begin November 30th. However, the Department of Homeland Security has accelerated the opportunity. It is now accepting applications online through the Customs and Border Protection's electronic system for travel authorization. And those are the top regional and international stories. I'm Carrie Simpson.
And we head to a quick break. When we come back, Jermaine Brown will have your midday sports report.